Everyone. Good afternoon for everyone here in Indonesia, and good morning to our headquarters colleague in Rome joining us on today's event. It is an honor to be with you today. I'm Rain Swadamara, Partnerships Officer for the World Food Program in Indonesia, and I will be your MC for today's event. Thank you for joining our national virtual launching and dissemination of Fill the Nutrient Gap (FNG) analysis in Indonesia. Before we commence our event, I would like to acknowledge the presence of our distinguished guests in this event today. Our keynote speakers, Mr. Pungky Sumadi, Deputy Minister for Demography and Manpower, BAPPENAS, Bapak Arifin Rudiyanto, Deputy Minister for Maritime and Natural Resources, BAPPENAS, Mr. Subandi, Deputy Minister for Human Development, Community and Culture, BAPPENAS, and our discussant, Mr. Pungkas Bajuri Ali, Director of Public Health and Nutrition, BAPPENAS, Ms. Rina Agustina, Chair of Human Nutrition Research Center, IMERI, Universitas Indonesia, Dr. Dhian Dipo, Director of Public Health Nutrition, Ministry of Health, and Bapak Anang Nugroho, Director of Food and Agriculture, BAPPENAS. I would also like to greet WFP representative, Ms. Christa Räder, Ms. Saskia, Chief of System Analysis for Nutrition, WFP Headquarters in Rome. A very special thanks to our donors, UN COVID-19 Response and Recovery Multi-Partner Trust Fund and USAID, distinguished representative from donors, UN agencies and development partners, distinguished guests. Thank you once again for joining our national virtual launching and dissemination of Fill the Nutrient Gap analysis in Indonesia. The Indonesia FNG analysis took place from September 2020 to November 2021. It was conducted by WFP Country Office with technical assistance from the System Analysis for Nutrition team at WFP Headquarters, working in close collaboration with BAPPENAS and the Ministry of Health. A wide range of national experts and stakeholders provided input throughout the analysis. On the 5th of August 2021, a virtual multi-stakeholders workshop was held to verify and validate the findings of the complete FNG analysis and prioritize actions based on these findings. Today, national launch of the FNG analysis in Indonesia is an important step to initiate a policy dialogue on strengthening malnutrition prevention with multi-stakeholders, including the government of Indonesia, international development partners, academic networks, and donors. We will together listen to the presentation from WFP Headquarters Global Analysis Team on the results of the FNG analysis 2020-2021. The agenda for today's event will be welcoming remarks, followed by the keynote speech from BAPPENAS. We will then have the symbolic launch and the photo session. Following this, we will have a presentation of the Fill the Nutrient Gap Indonesia final result, followed by discussion and Q&A session, and we will end the event with a wrap-up and closing. Before we start our event, we would like to remind you several of our house rules. So the workshop will be conducted using English. However, we will have interpretation features available. You may find below your Zoom screen the interpretation button, which you may click on your preferred language. So when the speaker is speaking English, you may wish to listen in Bahasa Indonesia, then please select Indonesia. Or if the speaker is speaking in Bahasa Indonesia and you wish to listen in English, please click on the English selection. During the discussion session, you are also welcome to use your preferred language. However, as we have simultaneous interpretation throughout the entire event, may we kindly ask the speakers to please speak clearly and not too fast. For the online attendance, please fill in the online attendance form through the link in the chat box. You can introduce yourself in the chat box starting from now. During the question and answer session, you may address your question in the Q&A box. The format to ask the question would be organization name, your name, target speaker, and question. Ladies and gentlemen, without any further ado, let us commence our national virtual launching and dissemination of Fill the Nutrient Gap analysis in Indonesia. May I kindly invite our WFP representative, Ms. Christa Räder, to kindly deliver the welcoming remarks. Christa, the screen is yours. Thank you.
Thank you very much, Rain. Honorable keynote speakers, Dr. Arifin Rudiyanto, Dr. Subandi, Dr. Pungky Sumadi, we are deeply honored by this high-level presence for today's event. Respected discussants and experts, Dr. Pungkas Ali, Dr. Rina, Agustina, Dr. Dhian Dipo, represented by Ibu Yuni, Pak Anang Nugroho, and from our headquarters, Dr. Saskia DP. Also representatives of other government ministries, agencies and offices, development partners, and academic institutions. Ladies and gentlemen, it is indeed a great pleasure to welcome you to this launching of the results of the Field and Nutrient Gap Analysis work in Indonesia. It was conducted to gain a better understanding of what portion of the population in which parts of the country can or cannot afford an adequate nutritious diet. Many experts were consulted to propose a range of interventions to address the situation. Our experts then demonstrated with data from Indonesia what could be done to make a nutritious diet more affordable for more people, especially for those who need it most, such as pregnant and nursing women and adolescent girls. Indonesia has made considerable progress in poverty reduction in recent decades. The proportion of the population living under the national poverty line decreased from more than 19% in the year 2000 to 9% in 2019. However, many people remain vulnerable to poverty and malnutrition. The impacts of the COVID-19 pandemic have exacerbated these vulnerabilities, especially for the poorest households, which risk reversing some of the socio-economic progress made. In anticipation of the potential negative impact of the COVID pandemic on nutritional status and affordability of a nutritious diet, WFP included the Field and Nutrient Gap Analysis as a focus of its activities under the United Nations COVID-19 Multi-Partner Response and Recovery Fund. Indonesia is facing a triple burden of malnutrition, undernutrition, micronutrient deficiencies, and overweight or obesity. All three forms of malnutrition have a common root cause: low quality diets. The diets of people of middle and lower income levels tend to be of low nutritional value and low diversity, with a heavy reliance on staple foods, especially rice. And it is observed that with rising purchasing power or income, a switch from staples to processed food and meat takes place, but not necessarily to more nutritious or even healthy diets. Improving diet quality could definitely help to respond to all forms of the triple burden. There are many factors that determine whether people consume nutritious diets or not. To better understand these factors, WFP, in close coordination with the Ministry of National Development Planning and the Ministry of Health, undertook a so-called Fill the Nutrient Gap analysis. The objective of the analysis was to highlight likely dietary inadequacies and identify barriers to adequate nutrient intake in Indonesia, as well as to build consensus on priority interventions and policy options to improve nutrition of population groups across the life cycle through various sectors and programs. The Fill the Nutrient Gap analysis found that a diet that meets nutritional needs costs at least 8,500 rupiah per person per day on average, and ranges from 6,500 to 14,000 rupiah per person across provinces. Nutritious foods are much more expensive than staple foods. Compared to a staple-based diet that meets only energy needs, the nutritious diet costs 2.5 times more. Although nearly everyone in the country can nowadays afford a diet that meets the energy needs, a nutritious diet is much less affordable. There are areas such as NTT, Maluku, and Papua, where food costs are high and non-affordability is high. There are other areas, and in fact most areas, where food costs are medium to low and where the non-affordability is low. And there are areas like Jakarta, where food costs are high, but non-affordability is low. On average, at least 12% of the population cannot afford a nutritious diet. And this means a lot of people in a country of more than 270 million people. Although in some provinces, especially in the eastern part, this is even as high as 53%. So more than half of the population cannot afford a nutritious diet. Bringing nutritious diets within reach of all households and leaving no one behind requires actions in multiple systems, including agriculture and food systems, health and social protection. Options mentioned in expert consultations were staple food fortification, use of micronutrient powder, adequate cash and food transfers, and knowledge transfers for better practices, as well as a more diversified food production, especially by smallholders. This launch today will hopefully help leverage opportunities and expand strategic collaborations amongst stakeholders in Indonesia to improve availability, accessibility, and affordability of nutritious diets to prevent malnutrition. I would like to express our appreciation and gratitude for the engagement of staff at all levels in BAPPENAS, in the Ministry of Health, and other government entities, academic networks, and development partners. And this is the moment to also acknowledge the technical competence, the tremendous work and passion of the WFP Headquarters Fill the Nutrient Gap Global Analysis Team, under the leadership of Saskia Dipo, Sabrina Kuri, and Gregory Sklama. We would also like to take this opportunity to thank the donors who contributed to the UN COVID-19 Response and Recovery Multi-Partner Trust Fund, and the United States Agency for International Development for making the Fill the Nutrient Gap analysis in Indonesia possible. Thank you for your interest in joining this launch.
Thank you very much, Christa. Distinguished guests, ladies and gentlemen, we will continue our event with the keynote speech. We will hear 3 keynote speech focusing on the multi-action of 3 areas: health and nutrition, social protection, and food systems and agriculture. May I have the honor to call our first keynote speaker, Bapak Dr. Insinyur Subandi, MSc, Deputy Minister for Human Development, Community and Culture, Ministry of National Development Planning, BAPPENAS. Bapak Subandi, the screen is yours.
Thank you. Good afternoon, everyone. By the way, my name is Pungkas. I would like to convey Pak Subandi sincere apology for he cannot making to this meeting because he's accompanying our minister in another important meeting. So I would like to read his speech for this occasion. The honorable speakers, presenters, audience, Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, ladies and gentlemen. It is an honor for me to speak in this very important events, virtual launchings and disseminations of Fill the Nutrient Gap of FNG analysis. Let me start with the fact that in the National Medium-Term Development Planning 2020-2024, we have targeted the improvement of quality and competitive of human resources. This is in line with the achievements of Indonesia Emas in 2024 that has been our aspirations for quite some times. One of the keys in ensuring the development of human resources is to ensure the nutrition status of the populations. Nutrition investments is a high return investments. For every dollar we spend on nutrition interventions, we could get $16 in returns to the economy. This amount would increase significantly when the investments is aimed at life savings and high impact interventions. In the National Medium-Term Development Plan 2020-2024, we have targets addressing nutrition problems, including stunting and wasting reduction programs, especially among children, as well as reducing the prevalence of adult obesity. This outcome will be achieved if we can ensure that people have access to balanced and adequate diets. There are policies and strategies to ensure the quality and the quantity of food consumptions. The RPJMN regulates the provisions of food assistance, including the improvement of the use of local food, fortifications, biofortifications, food labeling, pre- and post-market food monitoring, and other interventions. There are also policies to strengthen the commitment in the foods and nutrition sectors, such as the National Action Plan for Food and Nutrition, or RANPG, as well. As a matter of fact, this is one of our commitments that has been registered into the N4G summits coming in December 2021. So in addition, the law requires that all provinces, all districts also develop and implement the subnational food and nutrition action plan. So I highly appreciate all parties, particularly WFP, who have been committed in conducting the analysis. And then we now realize how important is affordability as one of the main policy that need to be pursued in ensuring the adequate and balanced diet. Sorry, I think I've been disconnected. I would like to repeat my Pak Bandi last statements. I highly appreciate all parties, particularly WFP, which has been committed in conducting the analysis, and we now realize how important is affordability as one of the main policy need to be pursued in ensuring the adequate and balanced diets, which in the end will help us in combating both over and under malnutrition. This will help us in the evidence of affordability to balance and adequate diets in the local context, and I hope further triggering our efforts to the better nutrition policy. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Terima kasih banyak Pak Pungkas. Thank you very much Bapak Pungkas representing Bapak Subandi. Ladies and gentlemen, we will now proceed to the next keynote speaker. May I now kindly invite Dr. Pungky Sumadi, MCP, PhD, Deputy Minister for Demography and Manpower, Ministry of National Development, Planning BAPPENAS. Pak Pungky will deliver his keynote speech focusing on the social protection issues. Pak Pungky, may I please hand you the screen?
Terima kasih Ibu Rain, Ibu Christa, Pak Rudi, Pak Subandi, distinguished discussant, ladies and gentlemen. Thank you for inviting me to give a short speech at the launching of Field and Nutrition Gap Analysis in Indonesia. We thank World Food Programme for the partnership to generate an important piece of work in preventing malnutrition, Field and Nutrition Gap Analysis. I welcome this excellent work that provides new findings and insights. Since the past 14 years, the government has been implementing social assistance programs, namely Program Keluarga Harapan and Sembako. That put the importance of providing better nutrition to the needy families. Social assistance programs are important to bring nutritious diets and other essential needs within better reach of households and to protect the most vulnerable from the worst effects of the pandemic downturn. The Sembako program provides households improved access to food, but makes a small contribution to overall nutritional requirements. The inclusion of subsidized fortified rice in Sembako could bring down the cost of nutritious diet by 12 to 23%. The value of the program Keluarga Harapan transfer for the modeled household covers 20 to 40% of the cost of a nutritious diet if spent optimally. PKH combined with Sembako can cover 29 to 53% of the nutritious diet cost. Social assistance programs should be more nutrition sensitive through improved targeting, ensuring an adequate transfer size, offering a range of nutritious commodities in the case of food transfers, and creating demand among participants for nutritious foods. In our PKH program, especially in the family development session, we teach nutrition education subject to help households optimize the utilization of the allowances by guiding participants on the use of cash for nutrition purposes, healthy eating, and food consumption habits. Although our social assistance programs are run by the national government, we also acknowledge other programs being implemented by local governments. Therefore, we ought to strengthen local government capacity on nutrition and on implementation for nutrition interventions to ensure social assistance programs are used as a platform for nutrition. We hope all decision makers can use the analysis to strengthen policies in improving the availability, accessibility, and affordability of nutritious diets through social protection programs in Indonesia. Thank you very much.
Thank you very much, Pak Pungky. Distinguished guests, ladies and gentlemen, we will now proceed with the third keynote speaker. May I now kindly invite Dr. Insinyur Arifin Rudiyanto, MSc, Deputy Minister for Maritime and Natural Resources, Ministry of National Development Planning, BAPPENAS. Arifin will deliver his keynote speech focusing on food systems and agriculture. Pak Arifin, may I please hand you the screen?
Thank you, Bu Ren. Please allow me to give a speech in Bahasa. Yang kami hormati Bapak Subandi, Deputi Bidang Pembangunan Manusia, Masyarakat dan Kebudayaan, Pak Pungky, Deputi Bidang Kependudukan dan Ketenagakerjaan, Pak Pungkas, Direktur Kesehatan dan Gizi Masyarakat, WFP Indonesia Country Director, Bapak Ibu perwakilan dari Kementerian Lembaga, Organisasi Kemasyarakatan, Akademisi dan Perguruan Tinggi, Mitra Pembangunan dan para pelaku usaha, para peserta dan tamu undangan yang hadir pada hari ini. Assalamualaikum warahmatullahi wabarakatuh, selamat siang dan salam sejahtera bagi kita semua. Mengawali diskusi ini, marilah kita panjatkan puji syukur kehadirat Allah Subhanahu wa Ta'ala atas segala limpahan rahmat dan karunia-Nya, sehingga kita masih diberikan nikmat sehat dan bisa bersilaturahmi pada acara launching analisis Fill the Nutrient Gap saat ini. Kami menyampaikan terima kasih kepada WFP Indonesia dan Jakarta Post atas dukungannya dalam penyelenggaraan acara pada hari ini. Selain itu, kami juga menyampaikan penghargaan kepada para keynote speakers, penanggap, moderator, dan seluruh peserta atas partisipasi, komitmen, dan kontribusinya dalam pembangunan pangan dan gizi di Indonesia. Hadirin yang saya hormati, tujuan pembangunan berkelanjutan SDGs yang telah menjadi kerangka dan arah masyarakat dunia dan juga target-targetnya harus dicapai sebelum tahun 2030, itu menjadi komitmen kita semua, termasuk Indonesia juga memberikan komitmen yang kuat dalam melaksanakan dan mencapai target-target SDGs tersebut. Dalam kerangka SDGs, pencapaian tujuan yang kedua, terutama dalam mengakhiri kelaparan dan malnutrisi, mempunyai tantangan yang sangat besar. Pandemi COVID-19 menambah tantangan yang kita hadapi. Pandemi COVID-19 juga mengkoreksi tren perbaikan yang telah kita capai sebelumnya. Laporan kita dalam Indonesian Voluntary National Review tahun 2021 tentang SDGs menyampaikan bahwa tantangan pada capaian tujuan 2 tadi antara lain adalah masih tingginya prevalensi stunting and wasting, serta kenaikan prevalensi angka ketidakcukupan energi sejak 2020. Isu stunting dan wasting masih menjadi perhatian kita bersama. Tidak hanya persentasenya yang masih relatif tinggi, namun juga percepatan penurunannya yang masih perlu kita percepat kembali. Kita juga mencermati bahwa terdapat keragaman antar daerah yang tinggi terhadap kondisi stunting and wasting ini. Selain itu, skor pola pangan harapan tahun 2020 sebagai salah satu indikator utama dalam rencana pembangunan jangka menengah tahun 2020-2024 belum mencapai posisi ideal. Saat ini masih dalam nilai 86,3 dari skor ideal 100. Skor pola pangan harapan mencerminkan kualitas dan keragaman konsumsi pangan dan gizi masyarakat, sehingga kita masih terus melakukan upaya perbaikan kualitas konsumsi pangan tersebut. Situasi dan proyeksi global, regional, dan nasional perlu terus kita cermati dan antisipasi melalui transformasi sistem pangan kita. Permasalahan dan proyek di atas menjadi catatan penting bagi kita dalam melaksanakan transformasi sistem pangan agar lebih bergizi, inklusif, berkeadilan, handal, dan berkelanjutan. Bapak Ibu yang kami hormati, sistem pangan telah menjadi salah satu kegiatan prioritas nasional yang tertuang dalam Peraturan Presiden Nomor 18 Tahun 2020 tentang Rencana Pembangunan Jangka Menengah Nasional 2020-2024, yaitu program prioritas peningkatan ketersediaan, akses dan kualitas konsumsi pangan. Ini dilaksanakan dengan kegiatan prioritas peningkatan tata kelola sistem pangan nasional. Selanjutnya, program prioritas tersebut menjadi arahan perencanaan dan penganggaran tahunan yang termuat dalam rencana kerja pemerintah. Dalam ranah perencanaan dan penganggaran ini, sistem pangan berkelanjutan memerlukan perubahan fundamental yang perlu dilakukan secara lebih holistik, yang mencakup seluruh mata rantai nilai dan pelaku dari agro-food system. Aktivitas dalam mata rantai nilai tersebut ditujukan guna memenuhi kebutuhan pangan yang cukup, bergizi, beragam, seimbang, dan aman, yang tercermin dari skor pola pangan harapan konsumsi pangan masyarakat. Pembangunan sistem pangan diarahkan untuk transformasi perencanaan dan penganggaran dengan pendekatan perencanaan sistem pangan yang berorientasi pada demand driven dan evidence based. Terkait demand driven, dengan sektor pola pangan harapan sebagai salah satu acuan, selanjutnya diturunkan ke dalam perhitungan target kebutuhan konsumsi pangan, kebutuhan pasokan pangan, dan juga sistem produksi. Terkait evidence base, ini diharapkan diskusi kita hari ini diharapkan memberikan andil yang nyata sebagai dasar kebijakan kita dalam merumuskan pilihan dan alternatif kebijakan tersebut. Forum hari ini diharapkan dapat memberikan informasi makro mikronutrisi yang perlu kita prioritaskan. Pemerintah juga memandang penting perlunya membangun regionalisasi dan lokalisasi sistem pangan, di mana sistem pangan dapat dibangun secara handal dan berkelanjutan pada potensi daerah masing-masing. Pola konsumsi masyarakat daerah juga mendorong pangan lokal atau kearifan lokal di daerah. Penguatan ketersediaan pangan harus terbangun dari beragam bahan pangan lokal setempat yang tetap harus bergizi, serta rantai nilai sistem pangan harus memberikan manfaat yang berkeadilan bagi seluruh pelakunya. Bapak Ibu yang kami hormati, pemerintah menyampaikan terima kasih kepada WFP yang telah mendukung secara penuh pelaksanaan Fill the Nutrient Gap Analysis ini. Rangkaian kegiatan yang telah dilaksanakan dalam analisis ini tidak hanya memperkuat dasar telah kita, namun sekaligus wahana dalam membangun konsensus dan meningkatkan proses dan kualitas kebijakan kita. Kami berharap analisis ini memperkaya evidence base untuk peningkatan kualitas konsumsi pangan dan gizi melalui intervensi dan pilihan kebijakan berbagai lintas sektor, termasuk kesehatan, bantuan sosial, dan sistem pangan. Demikian yang dapat kami sampaikan. Terima kasih. Wassalamualaikum warahmatullahi wabarakatuh. Tetap sehat, senyum, dan semangat.
Terima kasih banyak Pak Arifin. Ya, tentu saja tetap sehat, senyum, dan semangat. Okay, distinguished guests, ladies and gentlemen, we will now proceed with the national virtual launching of the Fill the Nutrient Gap Analysis in Indonesia. May I now have the honor to invite again on the screen our WFP representative, Ms. Christa Räder, and also our three keynote speakers, Bapak Subandi, represented by Bapak Pungkas, Bapak Pungky Sumadi, and Bapak Arifin Rudiyanto, to join us and on the virtual launch. Bapak dan Ibu, yes, you may see on the screen, you will have a virtual button on your left, a rounded circle button on the left down corner on your screen. May I kindly ask to raise your right finger above your shoulder? Yes. Yeah, okay. We will together witness you to virtually push the button. I will count down from 3 until 1. When I say press the button, please do so by moving your hand toward the circle or the button. Okay, are you ready, Bapak dan Ibu? Yes? Okay, 3, 2, 1, press the button.
What does it take to put healthy diets within everyone's reach? It depends on where you are, who you are, what foods are available to you, and if you can afford them. For every context, Fill the Nutrient Gap analyzes what prevents people from eating a nutritious diet and helps design the best solutions to provide access to good nutrition for all. Developed by the World Food Programme together with partners, Fill the Nutrient Gap helps decision makers build sustainable food systems for their countries. It's a process that engages stakeholders from health, education, social protection, nutrition, agriculture, and private sectors at every step, and uses the cost of the diet software to estimate how much it costs a family to buy the nutritious foods they need in local markets, and whether it's affordable based on their income. The results are combined with insights from research on agricultural production, living conditions, consumer behaviors, and food culture, to build an understanding of the diverse and complex issues that influence what people could and do choose to eat. It also identifies opportunities for actions that could make healthy diets a reality for all.
Ladies and gentlemen, we have officially witnessed the launch of the Fill the Nutrient Gap analysis in Indonesia. Thank you so much, Christa, Pak Pungkas, Pak Pungky, and Pak Arifin. Distinguished guests, ladies and gentlemen, before I continue our event, we will do a quick photo session. May I invite to the photo session again, Ms. Christa Räder, Bapak Pungkas, Bapak Pungky Sumadi, Bapak Arifin Rudiyanto, Bapak Anang Nugroho, Saskia S.TP, Ibu Rina Agustina, and Dr. Dhian Dipo. Okay, we will now do a quick photo session. We will have two quick photo sessions. The first one is the formal one. The second one, you're free to express how you want it to be. All right, for the first one, 3, 2, 1, smile. Okay, and then the second one, it's a freestyle. You can do whatever you want. 3, 2, 1. Thank you, everyone. Terima kasih, Bapak dan Ibu. Baiklah, kita akan lanjutkan sesi selanjutnya. Distinguished guests, ladies and gentlemen, let us now proceed to the main agenda of the event. Our next session is the presentation of the Fill Nutrient Gap Indonesia, the dissemination of the result. We will now have Ms. Saskia S.TP to present the FNG Indonesia final result. We will have 3 discussants, Bapak Pungkas Ali from BAPPENAS, Ibu Rina Agustina from Universitas Indonesia, and Dr. Dhian Dipo from Ministry of Health. Throughout the session, all participants are welcome to use the Q&A box for your questions. Make sure that you follow our format. Please state your organization, your name, your target question, and also the question. Okay, ladies and gentlemen, may we now proceed to the presentation of the Fill the Nutrient Gap Indonesia final result, which will be presented by Ms. Saskia S.TP, Chief of System Analysis for Nutrition WFP Headquarters. Saskia, you may have the screen.
Thank you very much, Rijn. Good afternoon, selamat siang, selamat sore di Jakarta. Senang sekali bisa presentasi hasil Fill the Nutrient Gap. Saya lanjutnya pakai bahasa Inggris. So it's a great pleasure to share with you the findings of the Fill the Nutrient Gap analysis. Different speakers before me just now already shared some key results. and some recommendations as well. So it's been a lovely process of engagement throughout the past year of conducting the analysis together with you. So I'll present a brief summary of the main results as well as the main recommendations. Let me make sure you can see my screen. Yeah, this should be working. So what did we do? We focused on food systems because diets are the center for achieving good nutrition and health outcomes, and of course together with good health. So how do people access diets that meet their needs? And those foods must be available in their food environment, and they should be able to, therefore physically, but also economically, access the foods that they need. And that, of course, comes with those foods being produced, being processed, being transported, and so forth. And then people make choices within their options for choice. So we really assess here what are the options for choice. So what we do for this is review secondary data on the food system to better understand where the bottlenecks may be. And we conduct linear programming where we assess what is the lowest possible cost to meet at least the nutrient needs. So from that, we gain an understanding of the challenges, and then we can explore what different solutions can do to improve affordability. And that then informs a prioritization of interventions across sectors. So a bit on this modeling, really what we recognize are 4 quadrants from where changes can be made. So to the top right, we can target specific interventions to specific nutritionally vulnerable individuals, be it supplementation, be it special menu recommendations, really ensuring that specific target groups also meet their needs. Then to the lower right, we have increasing the availability and lowering prices of nutritious foods, making nutritious foods more accessible and more affordable. We can also, to the left, increase the nutrient content of foods through fortification, which may be post-harvest fortification or bio-fortification. And of course, good storage also helps to retain nutrition that's in foods. And then to the top left, social assistance programs can increase household income and therefore food expenditure. So we explore all these possible ways to improve. And we've also reviewed the impact of COVID. So the structure of the presentation is that I'll present a key message. So this is the first one. And then I'll present how we got to this key message. So we'll have a total of 11 key messages for you. So in Indonesia, we see significant progress in the fight against stunting. However, malnutrition is not on the decline because there's also overweight, obesity, non-communicable diseases, which are increasing as a problem. And micronutrient deficiencies, they also prevail throughout. And this really signals to us that dietary quality remains the common underlying issue, which gives rise to both undernutrition, overweight and obesity, non-communicable diseases, and micronutrient deficiencies. Here we see the prevalence of stunting throughout the country, and we can see that it really varies. So there's also a lot of heterogeneity within the country. On micronutrient deficiencies, the evidence is, there is evidence and it's somewhat limited in terms of biochemical measures. However, anemia, gives us an indication of micronutrient deficiencies more in general, because it doesn't come alone. It comes from a diet that is not adequate, and it's not adequate in the nutrients such as iron, vitamin C, B12, vitamin A, that affect anemia, but it's also lacking then in other nutrients. These deficiencies occur together, so you can have signal indicators of these deficiencies. So micronutrient deficiencies, unfortunately, prevail, and it links to too low dietary diversity. Here we see a regional prevalences of stunting, so poor nutrition among young children, and overweight and obesity shown among adults. And you can see to the left, where stunting prevalence is lower, overweight and obesity is higher. And to the right, where stunting is still really high, overweight and obesity is a bit lower than in the areas shown on the left, but still it is high. So it's really a double, and if we include micronutrient deficiencies, a triple burden of malnutrition. And these forms of malnutrition, they take a heavy toll on Indonesia, on human capital development, and on productivity of the population. So lifetime earnings of the individual are lower, and the collective productivity of society is also less. So there's a lot of reason to address the issues that lead to the different forms of malnutrition. So now, and Christa already shared this when she introduced us to the launch, the lowest possible cost of a diet that meets nutrient needs on average in the country is 8,500 rupiah per person per day. But you can already see that it varies. And this is a mathematically optimized selection of foods. It's not a very nice diet. And we also know that a nutritious diet is at least 2.5 times more expensive than a staple-based diet that just meets the energy needs. So on average, we see the cost here, but we also see that throughout the country, that really varies. There's places, Papua, Maluku, but also Sumatra Barat, for example, where the cost is much higher than in Java, Nusa Tenggara Barat. So where you live determines what foods are available and what their costs are. So that drives now the cost of a nutritious diet. I already said that the lowest cost diet is a selection of foods arrived at through linear optimization. So it does meet the nutrient needs, but it's not a great selection together of foods. It doesn't make a very nice diet. So there's also a measure called the healthy diet, which is according to food-based dietary guidelines. And you can see here what we have as roughly estimated those costs to be. So that is 66% higher than the lowest possible cost for nutritious diet. So I'm sharing this just to realize what that lowest cost means. It is a mathematical figure as the lowest possible cost. But using it allows us to compare interventions such as fortification, such as supplementation, and really look at individual target groups. So don't be too optimistic about, oh, if somewhere in the country the non-affordability is like 8 or 10%, most people can afford it. What they can afford is that very optimized diet. But if we allow them to make choices that they like and that makes nice dishes, according to food-based dietary guidelines, the cost will actually be higher than what we show. So this lowest possible cost is not affordable for between 4 to 53% of the population, depending on where people live. So what the cost is, but also what their income is. And this is based on the SUSANA's 2019 data, which we used for the analysis. So if we would go with the post-COVID scenario or the current scenario, this is likely higher. Where a cost is lower doesn't necessarily mean that it's more affordable, because it's about the cost and it's about what people can spend. So this shows the proportion of the population that could not afford that lowest possible cost nutritious diet. And you can see how it varies, with up to 52, 53% in Maluku, but like 9% in Jawa Barat. Another interesting metric that we looked at is the affordability gap. So on this graph, the green line shows food expenditure, and then the horizontal line shows that lowest possible cost of a nutritious diet. So then anyone to the left here with an expenditure below that cost cannot afford it. And the extent to which they cannot afford depends how far their expenditure is from that lowest cost. And then we can also say, well, together, how much money do they lack? So that is what we have in this table. The total gap per year is 26,000 billion rupiah. And if we say, well, we want to know for people that are having this gap, how much do they lack per year? That is 740,000 rupiah for the year for a person if they are below that lowest possible cost with their food expenditure. I showed you that we are going to do some modeling, and we're distinguishing different type of settings. So we're looking at settings where the average household cost is high, and the non-affordability is high. That's our type 1 areas. That's Maluku, Papua, and Nusa Tenggara, Timor. The areas that we selected for the analysis. There's, of course, more areas in Indonesia, but we had to select a good number of them. Then Jakarta, low non-affordability, but high cost. So quite a unique situation. And type 2, where the cost is kind of medium and non-affordability is medium to low. So just so you see which areas this applies to. So now we get to the messages of the results. So we found numerous underlying drivers across a range of systems. They are responsible for the significant subnational variation. It's really difficult to just say, well, X% in Indonesia cannot afford. We really need to look at the different provinces and at urban and rural and at different income groups. So for the diet in Indonesia, they really remain heavily staple dependent. We see a decline gradually of staple intake, but that is really driven by the higher income quintiles. And when people are spending more money on food, they're not really making it much more healthy and nutritious. They're also increasing the consumption of prepared foods, amongst which is a substantial share of less healthy foods. High in sugar, high in fat, and too low in fruits, vegetables, and fortified foods. Of course, there's many factors that shape consumer choice and behavior, but it starts with having a choice. So if you cannot afford a nutrient adequate diet, you have very little choice. So we cannot expect those people to make good choices because they cannot afford good choices. People that are somewhat above that cost line, also for them, it's still difficult. I showed you the cost of the food-based dietary guideline diet being higher than the cost of that nutrient adequate diet. So ultimately, the cost is an important factor for being able to choose a healthy and nutritious diet. And the impact of COVID have exacerbated the vulnerabilities. And especially lower income households have been disproportionately affected, with more households falling into poverty. And therefore, nutritious diets are even further out of reach for them. So here we've summarized the many impacts of COVID, and really unemployment has increased. And it's the worst in sectors that, of course, have informal employment. The impact has mostly been on incomes, less on prices. Women and youth and people who already had the lowest and less secure incomes have been most affected. So they are more likely to experience food shortages, and urban areas relying more on the cash economy have been more affected. And households have depleted savings, so that reduces their resilience and adaptability to shocks. So here we are showing you basically hypothetical scenarios, because it was really hard to get good estimates of the decrease of food expenditure. So if food expenditure in NTT reduces, in urban areas of NTT, reduces by 10%, the second line here, you can see that that gap that we looked at, affordability gap, is increasing, and more people are not able to afford this lowest possible cost nutritious diet. So the proportion that cannot afford increases, and the extent to which they cannot afford also increases. And in green, you see the impacts in the rural area of NTT. So the COVID situation remains dire, and the scenarios for recovery are not fully known, but we can, of course, make predictions. So here we're showing what has been predicted by the World Bank, actually. So there's the estimates for growth. They vary, and it's going to be higher in 2022. And there's different factors determining the strength of the recovery. Of course, the national caseload and the global financial conditions as well. And then if the social protection package is continued, the poverty rates will decline. However, if that package would be reduced, it would increase. And here you see the extent to which that impact would be according to the modeled scenarios. So with that, we're going to go through three sections. The first one, health and vulnerable groups, then social assistance, and then food systems. So looking at the specific groups, adolescent girls and pregnant and lactating women, they are among the most nutritionally vulnerable members of the household because they have high requirements for nutrients. And targeted interventions can make a real difference. So let's look at that. So here you see a pie chart, and it shows that lowest possible cost of a nutritious diet for the household and the share of the different individuals that we looked at being in this household. And you see the adolescent girl would need 33%, and the breastfeeding woman 28%, and the adult man 21%. Why is that? To the right, in the bottom bar, you see the energy share of these different individuals. So amongst the adolescent girl in blue in the middle, the lactating woman, and to the right, the adult man, they have approximately the same share of energy needs. But if you go up and you look at calcium and iron needs, you see that that part for the adolescent girl is much bigger. and the part for the adult man has shrank. So it means that to meet the needs of the adolescent girl, more nutritious foods are needed by her, and they come at a higher cost. So if they share foods equally in the household, she is at a higher risk of her needs not being met. Here you see many bars. Let's look at the set at the bottom. This shows the cost of the nutritious diet for the adolescent girl, 22,613 rupiah per day. If she would receive a multiple micronutrient supplement, the cost would decrease, almost 19,000 rupiah. If she receives that 3 times a week, it would be 12,000. So you can see how much an impact it can make by providing a supplement that meets a good part of her micronutrient needs. And then you also see if it was just supplement of iron, folic acid, the cost would also decrease. But of course, it provides fewer micronutrients, just 2 rather than 15. So the cost decrease is a bit less with the iron, folic acid. So supplementation is a good way to address her specific micronutrient needs to complement a diet. Here we're showing the same now for a breastfeeding woman. And you can again, let's look at the lower half, see how iron folic acid 7 times per week versus 1 time, or multiple micronutrient supplements 7 times or 1 time, how that makes a difference. So basically providing it daily to the lactating woman can really make a good contribution to reducing the risk of deficiencies. And we're showing it here in the metric as how much does the cost of that nutritious diet decrease. So it can decrease by up to 40%. And we've also looked at if the household would have access to post-harvest fortified rice, then what proportion of the nutrient needs can be met, and therefore how does it decrease the cost? So you see for the adolescent girl, if she would be able to consume fortified rice, 25% lower her cost would be, because now that rice is so much more nutritious. Also for the lactating woman, it makes a big difference. For the adult man, it of course also contributes to micronutrient needs, but it's not so much less expensive. Now looking at children under 2, low dietary diversity and high snack food consumption prevent these children from meeting their nutrient needs. And this underlies stunting, as well as micronutrient deficiencies, as well as increasing the risk of overweight and obesity later in life. So this shows the households unable to afford a nutritious diet, so the proportion unable to afford across the provinces of Indonesia. And you can see where the unaffordability is highest, in Maluku, the children receiving minimum dietary diversity is less than 20%. So you can see how strong that correlation is between affordability and dietary diversity. And dietary diversity is what we need for nutrition. If we have taburia, micronutrient powder, that really complements the nutrient requirements of the child. So here we're showing the proportion of the nutrient needs that are met by breast milk, micronutrient powder, provided once or 3 times a week. And you can see how strong the contribution is from taburia to meeting the needs. So the rest of the gap here, of course, is filled by complementary foods. So this just shows breast milk and micronutrient powder, and then the remaining needs to be filled by the diet. And we also looked at these unhealthy snacks and drinks. So let's look at the one to the right for Jakarta. So in light blue is the cost of the nutritious diet, 3,500 rupiah per child per day. If the child receives cookies or biscuits or a sugar-sweetened beverage, such as a kotak juice, or a growing up milk, which is actually high in sugar, the costs are much higher to still meet the nutrient needs of the child, because we're now satisfying a part of the energy need, but still we need the nutritious foods to meet the nutritional needs. So that selection is now more expensive. And of course, we're paying also for these unhealthy foods. So this increases the risk of malnutrition, because it's unlikely that much more will be spent. The money is not spent very well, and therefore the risk of the child to meet the nutritional needs are declining. We can also make better interventions for the child. So let's look again, let's look at the type 1 rural, here the second group in the middle, showing you the cost of the nutritious diet. And remember that I said it's mathematically optimized. So now we're putting next to it a recipe for complementary food, sayur asam kangkung, that has a higher cost than that mathematically optimized cost, but it's not too much higher. There's also the possibility of giving the child MPASI, so the complementary food with a good nutritional value and with a relatively low cost. So that is cost-wise comparable to that complementary feeding recipe. So there is a choice, and people also need choices and need sometimes more convenient options. And then we also put in that growing up milk, which is not a healthy option. And you see that that cost is higher. So within what people can spend, different choices can be made, and we must help consumers to know what are nutritious and healthy choices and which ones are not. So based on this, the stakeholders prioritized the following interventions for health. Exclusive breastfeeding really needs strong support, and also continued breastfeeding. So to ensure that that exclusive breastfeeding is really supported, the critical period just before birth and the first few weeks of life are very important to support mothers to actually be able to breastfeed and get that going properly. And then we must really protect maternity at the workplace, and of course ensure and monitor compliance with the international code on marketing of breast milk substitutes. We should not confuse women in this early phase when their child's just born and they're trying to work this all out. Then from 6 months onwards, we need good, nutritious, complementary foods. And where the non-affordability of a nutritious diet and the ability to provide those foods is low, taburia can make a big difference. So the micronutrient powder. And we must also have nutrition education components and then a social and behavior change strategy properly implemented. We must nudge people to make good choices within the choices that they have. And that must be done not only at the health clinic, but it must also be done in shops. It must be done through community workers. It must be done through the agricultural sector, etc. This must be society-wide. And the regulation for processed foods needs to be strengthened, and especially for foods, the garam, gula, and lemak foods. Limit that content and limit the marketing of those. So then let's look at social assistance. Social assistance programs have the potential to bring households closer to meeting the nutritious needs. And protect them from the worst effects of the downturn due to the COVID pandemic. However, as Pungky also said, programs must be made more nutrition sensitive through improved targeting, ensuring that cash-based transfers do meet the gap that households face. And the food transfers must include sufficient nutritious items. And again, we must stimulate the demand for nutritious foods. So we've looked at sembako, and what we did was look at 3 possible scenarios of the foods that are received in the sembako package. These packages, the basic one is rice with eggs, and then some more protein as tempeh and chicken, and also then some banana and cassava leaf. However, all these options are the same value. So you don't get more food in the diverse scenario, you just get a bit more of different foods. But the cost is the same, and we modeled it to be 190,000 rupiah, because some e-warungs, they raise the cost a little bit to make up for their cost of implementing. And we also added fortified rice in one of the scenarios. So let's look at the results. This is showing it for urban areas. And you can see again the cost of a nutritious diet, now the cost for the household. And with the basic package, so just rice and eggs, the cost decreases by 7% in the type 1 urban areas, which are these areas in Maluku, Papua, so where the cost is high. If they get the improved package, so that was with tempeh and with chicken, there's a slight further reduction and a little bit more when it's a diverse package. And of course, there where the cost of the nutritious diet is lower, like in type 2, the difference made with sembako is bigger, just because proportionally it is bigger. It's the same value, but it doesn't buy you as much where food prices are higher. Now, if we take that most diverse package, and we exchange the rice for post-harvest fortified rice, then we can see that we can achieve a further reduction, which means that the nutritious needs are better met with that package, which to a large extent comes on the account of the fortification of the rice, and then together with a more diverse selection. And you can see that that difference is larger where the food prices are higher. So for a rollout, prioritize the areas where the cost of nutritious diets is higher. The needs are highest there. And now we're also adding in the PKH value. So if a household receives the sembako transfer and the PKH package based on the eligibility of the different members of the household, then you can see how large the reduction becomes. So in the type 2 urban area, a diverse sembako package with fortified rice and the PKH transfer now achieves a 54% reduction of the cost of a nutritious diet. This is making a big difference. So the prioritized interventions for social assistance, and we heard them from Pungky, basically is to make social assistance programs more nutrition sensitive. And you do that by reviewing the benefits package, look at the size of the transfer, ensure that it makes a substantial contribution to the gap that the participants have, and do take that regional variation in cost into account, because the same value buys you different amounts in different places depending on the prevailing cost of food, and help households to optimize the utilization of the allowance. So how to best use the cash that they have for nutrition purposes. and make sure that the nutrition education or the behavior change communication also reaches people participating in these programs. It's important for everyone, and it's also especially important for people that have fewer choices. Be well aware of how to optimize what you have. And strengthen local government capacity. That is where the understanding needs to be, so that they can make sure that the package of interventions that are delivered there are contributing as much as possible. They need to be aware to implement the good thing. And enhancing the contribution of social assistance to nutrition includes nutritious commodities in the transfer. So that is what I just showed on the fortified rice. And of course, there can be an addition of nutrition-specific interventions for specific groups. So if the household receives a Sembako transfer and has a child under 2, you may also add taburia for that child under 2. So assess how far the package can go, and then can there be another complementary intervention to top up that package for those who need that top up the most. So now the last section on food systems. Agricultural systems really have a strong potential to provide for affordable, nutritious diets. And I was very glad with Arifin's introduction of the topic and expressing strong commitment from the Indonesia government towards food systems change and towards the 2030 development goals. So yes, there is a great need for agricultural transformation, including policies that align the incentives with nutrition outcomes. So make sure what's done will affect that. And that can be achieved by promoting diversified production and also repurposing agricultural support. So that's about staple food support, rice policies. So Indonesia's import and export figures, they show a strong dependence on or strong role for import. So what we are showing here in this in the middle of the slide, the import dependency ratio shows the proportion of domestic consumption that comes from import. So soybean, 88% is imported. And for beef, a third is imported. Rice and maize, very small amounts are imported, but there is a net import. And the import of many fruits and vegetables has increased because domestic production has not kept pace with demand. So the population wants more diversity in the diet, but the food system does not yet provide for that. And so basically, domestic production is not adequately diverse, and there's been a very strong emphasis on the rice self-sufficiency, which has actually driven up the price of rice, but also of other nutritious commodities, because there's been less investment to optimize the production of these other nutritious commodities. And if the price of rice is relatively high, it means people have less money available to spend on other foods. So this lowers access to a nutritious diet. It leaves that nutritious diet cost at a higher point. So agriculture and trade policies required a reform so that we can have nutritious diets become more accessible. The rice prices in Indonesia are higher than the global average, which, as I said, affects the amount of money consumers can spend on other foods. So that affects the poorest the most, and also then drives up their risk of malnutrition. So there's really a need for a shift in orientation of agricultural production and also the spending on agricultural policies and on agricultural support. Then we also looked at the P2L program, which means nutritious foods produced by households. So here you're seeing the cost of the nutritious diet, and then the light part is the income that people could have, or households can have, from the self-production of nutritious foods. So that self-production can actually amount to an income of 25% of the cost of the nutritious diet in the type 1 areas with the higher nutritious diet cost. So it can make a big difference in households' income to self-produce and to self-produce quite optimally. We've taken a very good implementation of the program as an example here. And then I also already alluded to it briefly, rice fortification can help deliver micronutrients to households. Where post-harvest fortification really delivers a wide range and high levels of micronutrients. And biofortification also comes in, and it has the potential to better leverage the agricultural sectors to make foods more nutrient dense. It's important to really look at which micronutrients are added by different forms of fortification, how much of these nutrients, and therefore how much they can contribute to meeting the nutrient needs. So here we're comparing the post-harvest fortified rice and the bio-fortified rice, which is zinc fortified. Of course, they both require regulation to be in place. There must be a standard and there must be registration, and consumers should know which is which. Post-harvest fortification, we do it by producing fortified kernels that are then blended with unfortified rice. So you require these fortified kernels. So that means you need premix. For the biofortified rice, that rice must pick up more nutrients from the soil. So that does require the seed to be the kind that does that. And you may also need fertilizer to make sure that that nutrient is in the soil to be picked up. Of course, they both require a reliable supply chain so that there is a wide reach of the fortification. If it's added to social transfer packages, there we recommend post-harvest fortification, basically because it provides more micronutrients, and the needs among this group are such that you really need more micronutrients. There where the supply chain of post-harvest fortification cannot reach, and where people consume what they self-produce, of course, adding at least the zinc and potentially iron makes a worthwhile contribution. Consumers need to understand why it is good to consume fortified rice. So some knowledge of the benefits is important. And the rice should be as nice or nicer as the unfortified rice. And nice in terms of taste, visual appearance, and smell. So here we're looking at the impact on the cost of a nutritious diet of the different forms of fortified rice. So in the group 1 urban areas, so where the cost is highest, you see again that 65,000 rupiah for the household per day. If the fortified rice is added, and we have assumed that it's available in the market for 3% more cost than the unfortified rice, it could reduce the cost of a nutritious diet by 21%. The impact of the biofortified rice is very small. And that is because it only provides the zinc. It doesn't provide the other micronutrients. And then you see again there where the cost is lower. Of course, the contribution is proportionally also somewhat lower. So as I said before, the areas with the highest needs, with the highest cost, they are most in need of these interventions. So prioritize those for rollout. And the same for the poor in like Jakarta, where the prices are also high. So they will also benefit a lot from an intervention like this. And as I showed before, so now we've had a bit more background on what this fortified rice is. It can also make a good contribution to specific vulnerable individuals among the households that would consume the fortified rice. And then the last key message is on sort of looking further forward. We want our food systems to deliver for healthy diets for people, but also for the planet. And I'm really glad that Dr. Rina Agustina is also with us, because she's also very knowledgeable on this topic. So how can we look at the food needs in the country in 5 or 10 years, and how that can meet people's needs for good health, and how it can also meet the planet's needs for limiting the greenhouse gas emissions, limiting the environmental impact. So we've just published a paper together with Hardin, Fasli Jalal, and colleagues from Johns Hopkins University. And yeah, it's actually not in press anymore, it's published now. So looking at the greenhouse gas emissions, blue water targets, food expenditures, what we would like is a diet scenario that goes across the top of these bars, because then it would score well on all these indicators of the environment, of affordability, and of meeting nutritional needs. However, we see that there is none of our scenarios goes across the top. So it will take more to carefully balance this. And what we, for example, see is that the low food chain diet, so that includes mollusks, sardines, insects, it has a low environmental impact. It has a bit higher cost than current expenditure, and the nutritional value is a bit lower. Now, what if we included fortified rice there as well? What if we had a further look at the foods that can be selected? Maybe we can increase that score for nutrition. And the Eat Lancet diet, actually for Indonesia, has higher greenhouse gas emissions than the current diet. It does then better on nutritional scores. But it basically has higher emissions because Indonesia's diet has a lot of rice. And that doesn't have as high an impact as a more diverse diet. So it really takes further tweaking and exploring, and that should inform the trajectories for the food system transformation that we like. So the recommendations from the stakeholders on the food system are to scale up the P2L program to further increase smallholder income, and doing so through the production of nutritious foods. So that then increases the supply of these foods, and it increases the household's income. So that requires local government support, so they are able to replicate the P2L and ensure sustainability of the program. And encouraging private sector collaboration in the program as well to improve technology and agricultural mechanization. So being able to be more productive on these foods does require good technology and support. Also, biofortified crops are very suitable for smallholder agriculture. Then we must make sure that the smallholder farmers, that when they increase production, that they reach the market. They need to be able to sell their products. Post-harvest loss should remain small, and they must get it to the market where it can be bought, and it is bought at a good price. And we also saw the big price variation throughout the country. So we must assess the bottlenecks, what drives up the prices, and how can that be reduced. And also the linkage between food systems and social assistance must be strengthened. So take up post-harvest fortified rice in sembako is a very good way to make sure that the nutritional needs of the most vulnerable are better reached, and that social protection system provides demand that can initiate change in the food system. So this was the summary. I'm very glad to have been able to share it with you. And I also encourage people to review the summary. We saw it launched in the virtual launch just now. There's a lot to unpack and explore. Rijn, back over to you.
From
Sorry,
the
was he mute, Rijn?
I think I have already unmuted myself.
Yeah, just now. Yeah.
Okay. Yes. Thank you very much. Thank you very much, Saskia. A very great presentation, and then we can all see the excitement as well, because I can see from the Q&A box there has been several questions already asked. And before we continue, may I also invite participants to please, you can state in your questions directly using the Q&A feature under your Zoom screen. Don't forget to follow our format. Please write the name of your organization, your name, and who the question is addressed to, and also the question itself. Okay, thank you very much. So now, before we continue to the Q&A session, I will invite our three discussants to deliver the discussion. So we'll first now invite our first discussant. May I now invite Bapak Pungkas Ali, PhD, Director of Public Health and Nutrition, Ministry of Development Planning, BAPPENAS. Pak Pungkas, please, you may have the screen.
Thank you, Bu Rens. If I may, I will use bahasa Indonesia for responding as easier for me, obviously. Terima kasih banyak atas prestasinya, Ibu Saskia. Banyak sekali informasinya ya, jadi saya kira nanti saya akan membatasi komentar saya pada hal-hal yang menurut saya penting terkait dengan bidang saya, karena ini satu hal yang sangat menarik dan dulu sebagian juga pernah kita beri masukan. Dari studi ini memang sebenarnya menunjukkan khususnya untuk di kesehatan, permasalahan gizi ini permasalahan yang kompleks ya. Jadi ternyata walaupun studinya mengenai affordability, sebenarnya rekomendasinya tadi kan tidak simply dengan meningkatkan accessibility atau kemampuan untuk membeli gitu ya. Dilihat dari salah satu grafik tadi, begitu orang mampu yang sekarang ini mengkonsumsi staple food atau makanan pokok, tiba-tiba berubah ke makanan yang processed food dan yang meat, yang daging. Artinya berubah dari satu kekurangan pindah ke masalah gizi yang lain, dari kekurangan gizi menjadi kelebihan gizi. Jadi memang saya kira masalah pendapatan, masalah kemampuan ini memang sangat related dengan pemenuhan gizi, tetapi solusinya bukan hanya itu, karena kalau solusinya di masalah hanya kemampuan membeli, maka bisa terjadi pada shifting seperti tadi. Dan beberapa penelitian juga menunjukkan ketika orang meningkat pendapatannya, tidak serta-merta dia meningkatkan kualitas gizinya, tapi spendingnya itu justru pada pemenuhan kebutuhan-kebutuhan yang meningkatkan kenyamanan gitu ya. Dan itu terbukti penelitian juga di Indonesia yang dilakukan oleh S.TP dulu. Jadi artinya ya tentu affordability sangat berpengaruh, tapi kita bicara solusi, banyak hal yang perlu kita lakukan untuk menutupi gap tadi. Kemudian saya melihat di sisi kesehatan tadi yang sampaikan, dari sisi pendekatan penelitian tadi masih menunjukkan bahwa beberapa upaya social assistance ya, bantuan sosial, bantuan pangan, kemudian suplementasi seperti tapuria dan makanan MPASI dan lain-lain masih sangat membantu dalam hal bagaimana seorang penduduk itu bisa mengkonsumsi sesuai dengan kebutuhannya. Artinya gap itu bisa ditutupi dengan social assistance. Tapi tadi juga ada isu penting yang menjadi hal yang harus kita lakukan, terutama di sektor kesehatan, dan ini yang paling tidak mudah kalau menurut saya, karena masalah pengetahuan, behavior, dan behavior itu penyebabnya macam-macam. Satu karena edukasi, ya. Dua karena masalah kultur, ketiga masalah industri. Dan ketiganya ini juga bukan suatu perkara yang mudah. Misalnya kalau dari sisi pendidikan, ya tentu kita harus peningkatan pengetahuan, karena tingkat pendidikan kita yang masih rendah secara umum, maka mau nggak mau kita supply dengan edukasi mengenai pentingnya gizi yang beragam tadi. Nah, kemudian yang kedua adalah tadi mengenai masalah market, masalah pasar, aksesibilitas. Artinya pola konsumsi Indonesia saat ini, penduduk Indonesia saat ini, tadi disebutkan ya, sudah mulai berubah ke proses food. Nah, ini juga saya kira satu fenomena. Beberapa peneliti menunjukkan, dia menyatakan westernisasi of food diet. Jadi kita berubah kepada pola-pola makan yang proses food ya, yang itu juga macam-macam penyebabnya, faktor penyebabnya. Antara lain tentu adalah mengenai masalah market mechanisms. Saya kira kita hampir semua penduduk Indonesia saat ini, baik yang miskin maupun kaya, konsumsinya itu diperoleh dari market, dari pasar. Jarang sekali yang makanan itu adalah subsisten, diproduksi sendiri, dimakan sendiri. Nah, artinya mau tidak mau kita akan tergantung pada mekanisme pasar. Dan pasar kita tahu, pasar itu adalah supply dan demand. Apa yang diinginkan, maka itulah yang ada. Apa yang diinginkan dari sisi makanan itu biasanya menjadi penarik itu adalah mengenai palatability. Apakah makanan itu enak atau tidak? Dan ketika enak, maka kita akan tergantung pada masalah gula, garam, lemak. Nah, tentu ini perlu kontribusi yang tidak kecil dari sisi regulasi yang disebutkan. Mungkin yang belum disebutkan di sini adalah dari sisi industri atau bisnis. Kenapa ini? Karena menurut saya sangat penting ketika pola konsumsi kita semakin proses food, semakin ke arah barat, semakin maju kita, maka makanan yang kita peroleh pasti berasal dari industri-industri tadi, industri kecil maupun industri besar. Karena itu perlu juga edukasi tadi, tidak hanya kepada individu, tapi juga bagaimana pada sistem produksi, pada bisnis, untuk memperkenalkan makanan-makanan yang sehat tadi, yang sehat dari sisi gizi yang seimbang. Nah, jadi dengan seperti itu, saya kira beberapa kebijakan yang harus kita lakukan memang harus saling mendukung ya, saling mendukung. Nah, disinilah ketika sistem pangan berinteraksi dengan sistem kesehatan, dengan sistem pendidikan yang mau nggak mau kita harus bekerja sama ya. Saya kira semakin kompleks masalah ini, tetapi ya itulah yang kita hadapi ya. Kita hadapi tidak semudah solusi kita bayangkan. Dengan meningkatnya pendapatan, otomatis permasalahan akan selesai. Dengan tersedianya makanan belum tentu juga selesai. Jadi saya kira studi ini sangat menarik tadi. Terima kasih karena melihat dari satu sisi, tapi kemudian menarik kesimpulan bahwa ini implikasinya tidak hanya dari yang tadi, tapi banyak sekali hal-hal yang mau nggak mau kita harus bekerja sama multi stakeholder, khususnya kalau untuk memenuhi kebutuhan gizi. Yang terakhir, karena waktu, saran tadi beberapa kesimpulan dari studi ini yang menggunakan modeling ya, misalnya dengan adanya fortifikasi, beras fortifikasi ini akan menurunkan affordability, tentu dengan asumsi bahwa threshold pemenuhan gizinya tercapai ya, artinya itu standar gizinya tercapai, kemudian dia akan menurunkan harga ya, cost artinya akan semakin terjangkau. Nah, saya kira ini perlu juga dilengkapi karena pada studi tingkat mikro, tingkat individu juga tidak semudah itu, sulit. Ketika produk itu sudah di barang, ada fortifikasi beras, baik biofortifikasi maupun fortifikasi pangan yang telah jadi. Itu beberapa studi menunjukkan efikasinya juga belum tentu seperti yang kita harapkan. Walaupun kita tahu kalau itu dikonsumsi sesuai dengan kondisi, maka dia akan meningkatkan. Permasalahannya adalah kita hidup tidak di alam penelitian, bukan di daerah eksperimen yang bisa kita kontrol. Ketika beras fortifikasi ini sudah masuk ke sistem kita, maka banyak sekali pengaruhnya. Apakah manajemen kita bagus ya? Apakah kita bisa memberikan food fortifikasi beras tadi sesuai dengan kebutuhan? Apakah dikonsumsi dengan apa yang kita bayangkan? Nah, hal itu saya kira juga bisa melengkapi ini sehingga apa yang dimodelkan tadi bisa, ini kan yang model itu berupa potensi kemungkinan yang akan terjadi apabila kondisi-kondisi mikro tadi dipenuhi, dan kita punya banyak pengalaman. Hal yang menurut kita bisa menyelesaikan masalah ternyata tidak karena berbagai persoalan. Salah satunya dari manajemen project, manajemen program gitu ya. Itu yang juga kita alami, di mana sekarang kita stunting memang fokus pada manajemen program. PMT itu bagus, taburia bagus, tablet tambah darah bagus, itu dari dulu. Tapi kenapa kok nggak selesai masalahnya? Nah, mungkin pada saat manajemen program itu yang perlu kita perbaiki. Ini salah satu pembelajaran buat kita semua. Saya kira demikian dari saya. Mudah-mudahan bisa memberikan insight, dan terima kasih atas hasil studi yang dipaparkan, sangat insightful, dan kami akan menggunakan ini sebagai referensi. Kurang lebihnya mohon maaf. Assalamualaikum warahmatullahi wabarakatuh.
Ya, terima kasih banyak Pak Pungkas. Distinguished guests, ladies and gentlemen, we will continue our discussion with our second discussant. May I now kindly invite Dr. Rina Agustina, PhD, Chair of Human Nutrition Research Center, Indonesia Medical Education and Research Institute, IMERI, Faculty of Medicine, Universitas Indonesia. Dr. Rina Agustina, please, you may have the screen.
Thank you very much for Madam Master Ceremony. Assalamualaikum warahmatullahi wabarakatuh. Please allow me to share the screen. Okay, again, good afternoon, everyone. Congratulations for WFP, especially for Saskia the P, for the fill-in nutrition gap analysis and recommendation. And this actually have provide valuable findings to strengthen the policy in improving nutrition in Indonesia. I would like to begin with sharing the framework and vision published in our Lancet paper for universal health coverage. Here we know that Indonesia really has traveled a long road, and we have a long way to go. In the beginning, we are thinking that how people should receive better health service and perhaps even food subsidy, but this only done for selected people. Indonesia eventually transitioned to universal health coverage as the largest single-payer insurance scheme in the world, which cover for treatment of illness, especially the catastrophic disease, yeah. But this is actually, of course, the curative strategy, let's say. But it did not cover the serious preventive service. To make viable universal health coverage, we have to have something more. We have to go toward promoting preventive action, toward universal risk coverage, universal cost coverage, in which the food system fits in. We need a full transformation of society to make them a thriving individual, family, and society. To link with this, I think WFP have done an excellent work on the analysis, showing different diet analysis as presented by the P, lots of good analytic that bring together many different information, the typology of different countries, showing the affordability gaps, expenditure, showing how many gaps we face. Later, the essential aspect will lead to, of course, the promotive preventive action, linking health, social system, and food system transformation. WFP has brought some new things, especially on the current and potential diet in Indonesia and many models of different type of diet, meeting nutrient targets, affordability of diet, and environmental goal. Again, the issue of the shifting of dietary pattern was very important, which highlight the promotive preventive action, which is in line with this framework. However, in my perspective, the part that is not much yet there is still a lack of the actual needed is the how-to part on how actually to achieve this and what pathway should we go into and how we make the transformation. So in health aspect, I think WFP bring up the great issue on the exclusive breastfeeding and complementary feeding, and which is still far from the government target. I would like to highlight on lactation, which is actually still being not much of the attention, and this actually affect the exclusive breastfeeding. This is the most life-saving in the world investment. Of this should be more emphasized, especially on lactation counselor. It's very important to really encourage and overcome the misinformation from the market substitute of breast milk, wherein the midwife may be of the focus to support this service. Apart, and it's also on the complementary feeding, apart from the convincing efficacy of taburia, there's, I think, the need to really evidence on the effective program of this taburia implementation, especially on the monitoring and evaluation. This is also a great idea to bring issue of the sugary complementary feeding that may require perhaps sugary food and beverage tax, coupling with the healthy diet subsidy. And I would mention also WFP greatly mentioned about the MMS for adolescent and lactation. However, if we look at many evidence, the proven efficacy, the MMS for pregnant women is actually giving more big effect and more efficacy into that, especially the study done in Indonesia by Summit show the various different outcome, the fetal loss, birth weight, especially in girls, and cost-effective nutrition intervention should be then emphasized, especially in pregnancy. However, I understand that it's a lab course where preconception will be very important. However, as far as the first 1,000 days of life, linking to great idea of WFP that bring the issue about the return of investment, I think it is worth to look into the investment of child development, how the current food-based intervention, the supplementation can be coupling with psychosocial stimulation and care that would bring even more 4 or 5 times bigger effect on IQ and perhaps also the human capital. So the social assistance, I think, is really nicely and clearly presented by WFP, the importance of this key recommendation of the Sembako and PKH. What I think is missing there is about the social transformation, talking about the attitude toward food, nutrition, education for behavior change. So I think the investment on the strategy for behavior change, communication need to be more innovative, more work, how to this can link to the cultural change as mentioned also by Pak Pungkas and our study in many different parts of Indonesia at shifting from traditional diet to Western diet and how the traditional method of SBCC need to be improved. And I think the district level and government need to have more investment into that. Again, the power is always on our plate. So mainstreaming the healthy diet, balanced diet together with Sembako program should be done to ensure the family really buy the types of healthy food. And again, for the PTH that mentioned by WFP, it's really important message, but need to be a better targeting how this program can be sustained and effectiveness in improving the health and nutrition status. On the food system, I really like this part. I think this is the message key 9, especially on agriculture system. this is where the how-to part is actually delivered, although we need something more. But I would like to highlight when it is mentioned about domestic consumption, which I think we need to also emphasize on how the consumption of feed, which is actually translated into instant noodle and many processed food, is really, really striking, with even maybe change the rice consumption. And it's maybe almost importing really high, almost 50%, increasing, and consequently also added fats and sugar. And this is not only highest in urban, but also in rural and outer island. So therefore, I think on the key message 10 presented by Saskia is very timely. Shift in dietary pattern toward more nutritional diet. It's not only affecting the health, but also adversely impact to the environment and natural resources, and increasing the greenhouse gas emissions. So this is really something new, I think. Congratulations for the publication, especially on comparing the current and potential diet of Indonesia, that shows the trade-off between meeting nutrient targets, affordability of diet, and environmental goal. So this dietary shifting is indeed the essential message from the Eat Lancet Commission of Healthy Diet. And it actually shows the effect really can reduce the mortality, premature death of about 20%. So WFP also bring a very important role of smallholder and scale up the P2L program for further increase stakeholder income. This is, I think, the very good idea. The question would be how to operationalize that in a way that it is really actually work. So I think the local government needs to know about this one. And also, especially because the support of local government is really important to this implementation, as mentioned also by the presenter. So it needs to be how to make it articulated and to specify what kind of subsidy and support which actually support this message. So I think the important here is to do the analysis for the feasibility on how this will be worked. So this is going to be very valuable. So including also the recommendation of rice biofortification, this is a great idea, although this is not something new. But I think they are also face several challenges, as mentioned by also Pungkas, not only on technology use, perhaps also on the smallholder agriculture, technology, and consumer acceptance, and perhaps this needs to research and technology enhancement. So last but not least, I think there's still some mechanism of transformation needed, and how we can translate it to create this, and what should be done to enable this happen in district level, in village level, how much the finance also there, and how actually the district have it, and it might be new things to address. So again, I think the rapid transformation of the system, it might lead to how to, and the solution would need to create a systemic change at scale, district level and village level. So I would like to bring the end of my presentation is the healthy food production and consumption would be very important solution of how to, where food production driven by demands, health, sustainable, and economy, vice versa, and how food consumption driven by health, preference, availability, and cost. So again, thank you for your attention. Congratulations once again to WFP, and I hope this all can be beneficial. Assalamualaikum warahmatullahi wabarakatuh.
Thank you very much, Ibu Rina. A very interesting review indeed. Distinguished guests, ladies and gentlemen, I would like to invite our third discussant. May I kindly invite Dr. Dhian Dipo, Director for Public and Health Nutrition, Ministry of Health. Dr. Dhian Dipo, the screen is yours.
Oke, terima kasih Bapak dan Ibu sekalian. Izin saya akan membacakan pembahasan dalam bahasa Indonesia. Assalamualaikum warahmatullahi wabarakatuh. Selamat siang dan salam sehat untuk kita semua. Terima kasih atas kesempatan yang diberikan kepada Direktorat Gizi Masyarakat untuk menjadi salah satu pembahas dalam sesi kali ini dan mewakili Ibu Direktur Gizi Masyarakat Dr. Dhian Dipo. Mohon maaf pada kesempatan kali ini belum dapat hadir karena ada penugasan lain yang tidak bisa ditinggalkan. Saya Yuni, nutrisionis ahli di Direktorat Gizi Masyarakat, akan menyampaikan beberapa poin bahasan terkait dengan ranah kami tentunya di Kementerian Kesehatan. Dan tentunya terima kasih kepada WFP, kemudian Ibu Saskia dan tim yang sudah mendiseminasikan hasil dari analisis Field and Nutrient Gap ini. Tentunya kami juga selalu mengikuti prosesnya dan terima kasih atas analisisnya, masukan-masukan yang kami sampaikan juga sudah lengkap sekali masuk ke dalam hasil analisis FNG ini. Hasil dari Field dan Nutrient Gap ini tentunya sangat bermanfaat untuk dapat kami gunakan sebagai bahan pertimbangan dalam penyusunan kebijakan dan program ke depan yang berbasis bukti termasuk pada upaya penerapan intervensi gizi spesifik di negara kita. Beberapa hal sebelumnya sudah disampaikan oleh Dr. Rina, kemudian oleh Pak Pungkas, dan kami juga sangat setuju bahwa memang kelompok rawan utamanya remaja putri, ibu hamil, ibu menyusui, serta anak balita harus mendapatkan perhatian khusus, terlebih lagi pada mereka yang berada di bawah garis kemiskinan. Berbagai upaya yang dilakukan memang harus sejalan. Edukasi saja tidak cukup kalau akses terhadap makanan bergizi tidak mampu dijangkau oleh rumah tangga. Begitu juga sebaliknya, bantuan tunai atau bantuan non-tunai saja juga belum cukup apabila tidak disertai dengan edukasi untuk meningkatkan pengetahuan dan perbaikan perilaku dalam praktek pemilihan makanan, pengolahannya sehari-hari, serta pola asuh yang baik. Menyikapi hasil Field and Nutrient Gap ini, serta masukan yang diberikan pada bidang kesehatan, izin saya akan share screen, satu slide saja. Ya, mudah-mudahan sudah terlihat. Ini adalah intervensi gizi spesifik yang dilakukan di Indonesia dan terus diupayakan penguatannya untuk mencapai cakupan yang maksimal supaya memberikan daya ungkit yang cukup untuk mendukung percepatan penurunan stunting tentunya. Dan kami apresiasi sekali terhadap hasil analisis yang dilakukan dan memang masukannya juga cukup match dengan arah program perbaikan gizi ke depan yang kita upayakan bersama. Seperti tadi telah disampaikan juga bahwa ASI yang tidak optimal, kemudian keragaman makanan yang rendah, tingginya konsumsi makanan jajanan yang tidak sehat, itu bisa meningkatkan risiko masalah gizi dan memang pada kenyataannya ini menjadi tantangan bagi kita pada saat ini begitu. Seperti tadi disampaikan sudah berubah arah polanya, makanan olahan, makanan siap saji, gula garam lemaknya juga cukup tinggi, anak-anak yang sudah mulai bisa memilih makanan keluarga, sudah bisa jajan mereka. Kalau edukasinya tidak cukup dan pola asuhnya kurang baik juga akan mengarah ke sana, seperti itu. Jadi untuk itu sebetulnya sejak awal kita juga mengupayakan upaya promosi dan konseling ASI serta pemberian makan bayi dan anak melalui berbagai channel, termasuk salah satunya peningkatan kapasitas bagi petugas kesehatan dan lintas sektor agar berdaya untuk memberikan dukungan dan informasi yang memadai kepada ibu, kepada pengasuh, serta advokasi untuk menyusui membuat ruang menyusui di tempat kerja seperti itu. Memang masih sangat terbatas, tetapi pada saat ini dari 4 yang sudah kita upayakan advokasi dari sekitar 40 kementerian lembaga itu sudah sekitar 24 sudah punya ruang menyusui, memang ada sekitar 16 yang masih belum dan menjadi PR bersama untuk bisa sama-sama untuk mendukung ibu bekerja bisa menyusui seperti tadi yang disampaikan dalam sarannya. Kemudian terkait dengan pemberian makanan bayi dan anak ini tentunya kami juga berharap nanti dari hasil analisis ini bisa mendapatkan masukan yang lebih rinci terkait sebetulnya jenis protein hewani apa yang bisa mencukupi gizi dengan harga yang terjangkau. Seperti tadi disampaikan ada beberapa klaster, mungkin di klaster itu sebetulnya misalnya di klaster yang tadi jangkauannya harga makanannya juga mahal, tapi juga tidak terjangkau, yang tadi ada 3 klaster itu, mungkin barangkali bisa diberikan masukan kepada kami juga jenis protein hewani apa sebetulnya yang cocok untuk daerah-daerah tersebut, karena kita juga dalam upaya mengarah selain kepada pemberian makanan tambahan yang pabrikan tadi sudah disebutkan, juga sudah mengarah kepada pemberian makanan tambahan lokal yang tentu saja mudah-mudahan bisa lebih diterima dengan spesifik lokal seperti itu. Dan kemudian pada upaya suplementasi gizi mikro hingga saat ini juga memang masih dilakukan mengingat pola konsumsi masyarakat kita yang masih jauh dari gizi seimbang. Kelompok rawan yang jadi sasaran tentunya kalau untuk tablet tambah darah seperti kita ketahui bersama ada remaja putri usia 12 sampai 18 tahun, kemudian ibu hamil. 1 tablet setiap hari untuk ibu hamil minimal 90, kemudian 1 tablet 1 minggu setiap minggu sepanjang tahun untuk remaja putri. Lalu untuk balita juga ada kapsul vitamin A dan taburia. Nah, ini kami sangat tertarik dengan hasil taburia tadi. Memang kalau untuk suplementasi yang lain masih sudah blanket approach, tapi memang kalau untuk taburia kami masih terbatas jangkauannya. Tahun 2021 ini ada sekitar 60 kabupaten kota, di tahun 2022 diperluas menjadi 90 kabupaten kota. Dan tentunya hasil field and nutrient gap ini terkait taburia tadi akan menjadi masukan bagi kami untuk pertimbangan perluasan kembali dan dasar penentuan dari pemilahan wilayahnya tadi. Kemudian terkait penguatan regulasi gula garam lemak pada makanan olahan, juga makanan siap saji yang banyak dikonsumsi masyarakat kita tentunya menjadi sangat masukan yang sangat berarti untuk terus mengupayakan penerapan regulasinya, karena memang sebetulnya regulasinya sudah ada, gerakan masyarakat hidup sehat ada, kemudian regulasi terkait gula garam lemak ada, apalagi di lintas sektor lainnya juga ada pilihan lebih sehat yang regulasi itu juga sudah ada. Namun kemudian bagaimana mungkin kita bisa membangun koordinasi dalam pengawasannya, butuh peran besar tentunya dari semua pihak termasuk dari dukungan dari industri begitu. Kemudian terkait hal ini maka peningkatan kapasitas sumber daya yang ada, peningkatan kapasitas program, penguatan edukasi dan penguatan manajemen intervensi di posyandu maupun puskesmas menjadi bagian dari strategi untuk mencapai cakupan intervensi secara maksimal yang dikawal tentunya dengan surveillance gizi yang berkelanjutan. Bapak dan Ibu sekalian, terima kasih sekali lagi kami sampaikan atas hasil analisis dari field and nutrient gap ini. Sekali lagi tentunya akan menjadi bagian dari pertimbangan ke depan, karena memang sebetulnya arah kebijakan ke depan tentunya tidak serta-merta selalu blanket approach gitu, tetapi harus ada pengelompokan kabupaten atau clustering berdasarkan permasalahan untuk menetapkan sebetulnya intervensi yang cocok seperti apa. Demikian pembahasan dari kami. Terima kasih, selamat siang dan salam sehat untuk kita semua.
Terima kasih banyak Ibu Yuni Zahraini. Thank you so much Ibu Yuni Zahraini. Distinguished guests, ladies and gentlemen, I know you have been waiting for this session. After hearing the FNG final results and discussions by our discussant, I'm sure you have questions that you want to address to our speakers. I would like to invite you to please type in your questions using the Q&A features underneath your Zoom feature. Kindly type in your organization, your name, and who you are addressing the questions to and the question itself. We will read your questions and address it to our presenter and our discussant. We already have several questions that has been sorted out by our colleagues here. I will now read the questions first. Hold on a second. Let me organize everything. Okay. So we have 3 questions that we would like to address to Saskia P. The first questions come from Shahrizal Sharani from Zero Hunger Malaysia. Thank you, Saskia, for a mind-blowing presentation. I am keen to find out if there are any countries that have successfully implemented a most comprehensive program to fill the nutrient gap based on similar data structure presented, and how long did they take to improve? Perhaps share a best case scenario and key drivers. So I'm going to ask the questions, 3 questions, and then you can respond directly. Yeah? And then the second question comes from Bapak Yohanes Sondang Kunto from Universitas Kristen Petra. Saskia Depi, I see from your presentation, based on the cost of diet data 2021, I am interested that you show affordability is possible, but some subpopulation in Indonesia prefer otherwise. Does it mean a call for behavioral changes, social marketing should be done in the future to promote low-cost, healthy diet? Do you have any idea how to practically nudge this subpopulation to adopt healthy diet and perhaps to raise their awareness that healthy diet is affordable? How about the food preparation process in the households and the industry? Do you have the analysis on the good practice to preserve the nutrition value of food during the food preparation? I could imagine that variability in how households and industry process the food might be one factor affecting nutritional status in Indonesia. Okay, and this is the third question. So many enthusiasm from the participant. Another question also addressed to Saskia Depi, and also Pak Arifin Rudiyanto, perhaps, if Pak Arifin is also still available to answer. Numerous studies have shown that one of the key issues is that people in Indonesia have a very low intake of fruits and vegetables. On the other hand, Indonesia has a very biodiversity of fruits and vegetables. How many of these local resources remain underutilized? Will there be more commitment to bridge this gap and focus on increasing production and consumption of fruit and vegetable diversity? So I will give the floor directly to Saskia, and I will also invite the other discussant to also provide your thoughts. Thank you.
Yeah, thank you very much for those questions. And thanks so much for the great engagement. So many people online and so many questions asked. Yeah, we have been conducting these field and nutrient gap analyses since 2016. I've lost count on the exact number of Indonesia in the line, but it's about the 34th country, I would say, where we are finalizing the analysis now. We do see very nice uptake across the countries where it's been a longer while ago that we conducted the analysis, and it's the stakeholder engagement throughout the process is really being key. So we see doing this together and growing that understanding and thinking of what shall we now do and how can we do this together, that really creates a very good momentum. And how then to move forward with the findings towards results. Yeah, really depends on the opportunities and the ability of the people that have been engaged to see the opportunity and to see, yeah, we've seen this, that's why we should do this now. It's sort of building the arguments together, and this is a contribution to a much bigger process. And it's the process in the Ministry of Agriculture, it's the process in BAPPENAS, it's academic. So this is really to inspire towards further action. And yeah, we have seen countries where the social protection system has made big changes to become more nutrition sensitive. We have seen countries where school programming has increased the attention to nutrition, more nutritious meals, better nutrition information. Countries where the resilience programming has been adapted. So there's many examples, and it is really informing that process and doing this together. Yeah, consumers that would be able to afford a healthy, nutritious diet, now it is really, do they make the choice to do that? And that does require the nudging, and it does require a change of thinking around diet. It takes a change of food consumption practices, and that needs to happen throughout society. It's not only the consumer in their home and in the market. It's also what is in the market, what is produced in the food manufacturing industry. So ultimately, everybody should be moving in the same direction. So that does require a full strategy, not just a communication campaign. And also home preparation of foods, that needs to be healthy too. If we treat our visitors, why not treat them with nice fruits and with nice savory crackers or something like that, rather than something that's very very sweet. Lower the intake of sugary drinks, etc. And then on fruits and vegetables, yes, there is great diversity in Indonesia. It is really about making sure it's available in higher quantities, in more places, and that the price comes down. So that does require a focus on infrastructure, a focus on productivity of these crops, and a support to farmers to lower the risk, in case the harvest doesn't turn out well, etc. So that's also why these results need to be taken down to local government so that they can also act along the same lines. I hope this has answered the questions.
Thank you so much, Saskia. I will now give the floor to Pak Pungkas. Maybe you would like to also respond to the first and the third question, Pak? In addition to what Saskia just answered just now. Do you have any additional response?
Ya, terima kasih. Saya kira memang ini sesuatu yang kompleks ya, yang tidak mudah penyelesaiannya, tapi kita memang harus, kesimpulan saya memang kita harus saling, antara bidang ini saling bantu, saling bekerja sama gitu ya, bagaimana kita mengadres permasalahan-permasalahan tadi, karena saya juga tidak yakin ini menjadi satu paket yang disampaikan oleh Bu Saskia tadi mengenai permasalahan dan solusinya tentu tidak mesti menjadi satu paket penyelesaian. Beberapa negara tentu punya konteks masing-masing ya. Mungkin di antara itu kita juga perlu melihat ya, kalau kita dalam resource yang terbatas tentu kita akan memilih ya. Kalau dari sisi konteks penelitian tentu memilih yang koefisiennya besar atau memilih mana yang prioritas untuk penyelesaian. Dan itu penting. Saya kira juga berbeda-beda ya antara wilayah. Tadi kita lihat sangat menarik ya, dari kuadran tadi Nusa Tenggara, Papua, dan kalau nggak salah Maluku ya. Itu adalah daerah yang affordability-nya paling rendah gitu ya. Kemudian di sana yang permasalahan kan affordability 3 daerah itu, yang sangat berbeda dengan daerah-daerah lain gitu ya. Tetapi kalau kita lihat permasalahan gizi, ternyata tidak hanya di daerah itu. Permasalahan gizi ternyata juga di luar NTT, di luar Papua. Artinya memang tidak mungkin one single solution yang harus kita lakukan. Karena itu penelitian-penelitian ini sangat membantu kita untuk melihat peta sebenarnya permasalahan di lapangan seperti apa dan bagaimana penyelesaiannya. Dan kalau boleh saya merespon di sini ada pertanyaan untuk saya ini yang mengenai mana yang lebih efektif, apakah rice fortification atau biofortification. Saya kira kita belum punya satu penelitian untuk membandingkan cost effectiveness-nya kedua itu ya. Dalam konteks yang sama tentunya kita pernah punya eksperimen untuk rice fortification. Tentu mekanisme sangat berbeda. Dulu dengan beras raskin, sekarang beras raskin tidak ada. Wahananya sekarang adalah melalui PKH atau BPNT. Waktu itu penemuannya mix ya, ada yang efektif pada kelompok tertentu, ada yang tidak gitu ya. Nah, kalau rice biofortification ini kita belum tahu, tetapi saya kira ini bisa, yang kami sarankan juga kalau bisa dilakukan penelitian itu ya, supaya ketika kita memberikan rekomendasi bahwa beras biofortifikasi ini penting dan manfaatnya ada, itu perlu ada satu justifikasi yang kuat. Kenapa kita bilang seperti itu? Karena fortifikasi itu sebenarnya punya misi khusus. Fortifikasi adalah memperkaya satu bahan makanan yang kita harapkan dikonsumsi kepada seluruh penduduk, terutama yang penduduk tidak mampu, karena itu harga itu sangat penting, ya sangat penting. Nah, kita belum tahu kalau masalah cost efektif kan seberapa efektif dibanding cost-nya, ini yang kita terus terang belum tahu. Dalam proses itu saya kira ini sudah suatu breakthrough yang sangat baik ya. Kita ada satu potensi dari pengayaan makanan yang akan berpotensi bisa membantu permasalahan di Indonesia. Saya kira kalau masalah pengaruh pasti pengaruh ya, cuman seberapa banyak pengaruhnya dan bagaimana kita menyikapi di program kita, itu yang kita perlukan. Jadi saya tidak bisa terus menjawab pertanyaan itu karena kita belum punya risetnya. Tapi secara umum ya fortifikasi maupun beras fortifikasi ini suatu yang bermanfaat, yang memang kita di dalam RPJM juga kita sebutkan. Cuman dukungan penelitian lanjutan saya kira akan sangat membantu kita untuk mengambil satu kebijakan yang tepat bagaimana menyikapi dan memanfaatkan beras biofortifikasi dan fortifikasi yang sudah ada di Indonesia. Saya kira itu dari saya. Terima kasih.
Ya, terima kasih banyak Pak Pungkas atas tanggapan Bapak. Saya beri kesempatan kepada Ibu Yuni. May I now give the screen to Ibu Yuni to also provide some response. Thank you.
Ya, baik. Terima kasih atas kesempatannya. Terkait dengan hal ini, memang seperti yang tadi sudah disampaikan sebelumnya bahwa untuk sudah saatnya seperti itu ya, sudah saatnya kita memperhatikan masalah gizi itu berdasarkan wilayahnya, karena memang beda masalah, kemudian beda pula intervensi yang harusnya dilakukan seperti itu. Seperti dengan hasil Field Nutrient Gap ini, tadi ada beberapa klaster seperti itu, harusnya juga kan ini bisa menjadi bahan pertimbangan. Salah satunya seperti yang tadi saya sampaikan, misalnya ketika kita akan memperluas taburia tadi, kalau dengan makanan saja memang saat ini keadaannya agak cukup sulit untuk pemenuhannya kepada balita kita, kemudian dengan hasil bahwa taburia ini bisa mencukupi dengan syarat tadi seperti yang dikatakan Dr. Rina juga, monitoring dan evaluasinya harus benar, maka kemudian kita bisa memilah wilayah mana yang sebetulnya memang membutuhkan. Jadi prioritinya harus harus terlihat di sana. Jadi memang sudah saatnya kita melakukan pemilahan terhadap prioritas masalahnya, kemudian intervensi yang dilakukan dengan tentunya pengawalan untuk monitoring dan evaluasi untuk melihat perkembangannya seperti itu. Terima kasih.
Terima kasih banyak Ibu Yuni. Thank you very much Ibu Yuni. I will also give the screen to Dr. Rina to provide response.
Okay. Thank you very much. So I have to turn off the translation. Okay. In my perspective, Indonesia is actually very diverse and very heterogeneous. Yeah. But we are having the fourth largest population in the world. So I think what actually brought up by WFP and also some other pathway that we need to emphasize, it will enable Indonesia to lead the world. Indonesia can, government, the champion, BAPPENAS and Ministry of Health, Ministry of Agriculture should take this model for solving global health problem. But of course, with the different typology and different burden and also different potential resources, centralized one-size-fits-for-all will not address the population diversity and complexity. So it's really that we need to have the customized, innovative approach introduced in the population. And of course, I would think that this is really important to build the momentum for change. What has been brought by WFP, as mentioned by Saskia the P. So we actually need to take this moment in time for the championship. What we can do, I think it's already done. We have to align high-level policy and strategy, really to support all this idea, including the sustainable food future. Yeah, and because the importance of the behavior change, the essence of promoting preventive care. So it's really important to whatever we want to do is the really mainstream the principle of healthy diet and perhaps the sustainable diet. And because a lot of drivers coming from the food providers, so when we talk about food systems, so really need to involve the partnership with food providers and local pioneers. So how to do that, I think, as I mentioned earlier, really need to introduce the rapid transformation platform of the food system at district level, at scale, but also until the village level to really look at what subsidy there, what finance is there, really to have the healthy and food production consumption into one system, healthy information system that can enable the adaptability of the change in real time, but also I think the healthy scientist leader or healthy leader in the field. So that's actually very macro level that I would like to emphasize, but I think this may be very important to highlight. Thank you.
Thank you very much, Dr. Rina. Thank you very much, our discussant and also our presenter. We do have so many other questions on the Q&A feature, and that there's also some that goes through the chat box. However, as we are now already exceeding the time, and we do have two of our guests that we would like to also invite to share their thoughts. So I will now give the screen and would like to invite Bapak Iing Mursalin. Bapak Iing Mursalin and later on Ibu Felipa Amanta. But Bapak Iing Mursalin is the lead program manager of a national team for the acceleration of stunting prevention or TP2AK. Bapak Iing, kami persilahkan. You may please share your thoughts.
Baik, terima kasih Ibu atas waktunya. Mungkin saya akan bicara dalam bahasa Indonesia. Pertama, saya menyampaikan terima kasih atas presentasi yang sangat baik dan hasil studi yang sangat baik kepada tim WFP. Ini tentu saja bisa menjadi dasar bagi pemerintah ya dalam mengambil kebijakan-kebijakan terkait dengan pangan dan gizi. Dan ini juga secara waktu, menurut saya sih kita punya beberapa dokumen yang di-launching hampir bersamaan. Pak Pungkas dan tim beberapa waktu lalu, BAPPENAS itu meluncing RADPG, Pak Arifin, Pak Deputi. Ya. Sekarang kita mendapatkan gambaran tentang hasil studi yang dilakukan oleh teman-teman WFP. Dan dari hasil studi ini kita bisa melihat gitu ya bagaimana sih ketimpangan antar wilayah dari sisi pemenuhan kebutuhan pangan dan gizi. Gitu ya. Yang kedua yang ingin saya sampaikan adalah persoalan pangan dan gizi ini kan bukan hanya persoalan affordability dan availability gitu ya. Tapi ada persoalan perilaku yang harus kita perhatikan. Gitu. Kita sekarang sudah punya persoalan obesitas. Tadi Bu Christa juga menyebutkan tentang itu. Gitu. Itu artinya kita mulai transisi ini. Kita bukan hanya punya persoalan kekurangan gizi, tapi juga kelebihan gizi. Kami misalkan melakukan analisis terhadap satu kelompok, yaitu remaja putri, gitu ya, berdasarkan hasil riset kesehatan dasar. Ternyata memang konsumsi GGL, gula, garam, lemak itu memang sangat tinggi. Gitu ya. Pada kelompok remaja putri, misalkan data yang kami punya, 46,3% itu remaja putri kita itu mengkonsumsi makanan manis lebih dari 1 kali per hari. Kemudian 56,4% itu mengkonsumsi minuman manis lebih dari 1 kali per hari. Begitu pula untuk konsumsi lemak, angkanya di atas 40% gitu ya, yang lebih dari 1 kali per hari. Ini tentu saja fenomenanya bukan terkait dengan affordability dan availability, gitu. Tapi fenomenanya adalah terkait dengan perilaku. Oleh karena itu, tadi di rekomendasi yang disampaikan oleh teman-teman dari WFP, ada yang terkait dengan perilaku. Mungkin itu yang perlu kita kuatkan. Gitu ya. Kemudian yang ketiga, rekomendasi yang disampaikan oleh teman-teman WFP Itu beberapa memang sudah dilaksanakan ya oleh pemerintah, meskipun dalam skala yang beragam seperti tadi taburia gitu ya, itu sudah dimulai, hanya memang skalanya masih kecil. Biofortifikasi, fortifikasi beras itu sudah dilaksanakan meskipun skalanya masih piloting gitu ya. Tapi memang untuk mengeskalasi rekomendasi-rekomendasi ini nggak mudah gitu ya. Implementasinya menjadi tidak mudah gitu ya. Contoh misalkan terkait dengan penguatan promosi ASI eksklusif gitu ya. Kita tahu bahwa salah satu persoalannya adalah bagaimana kita membatasi pemasaran di level lapangan. Kita sekarang cukup senang dengan adanya pembatasan di iklan di televisi misalkan untuk susu formula. Tapi di lapangan melalui bidan desa, melalui para pelaku-pelaku penyedia layanan di lapangan itu menjadi masih tidak mudah. Salah satu rekomendasi yang diberikan oleh WFP adalah penegakan tentang conduct misalkan. Tapi bagaimana caranya gitu? Kita tahu bahwa itu harus dilakukan, tapi terus gimana caranya? Mungkin rekomendasi-rekomendasi yang lebih detail harus disiapkan. Yang lain adalah tentang taburia misalkan gitu ya. Tadi disampaikan bahwa taburia itu bisa mengisi gap nutritionnya gitu. Tapi tadi Bu Yuni menyampaikan bahwa ini sekarang ini masih piloting hanya di sekian kabupaten kota gitu. Untuk mengeskalasi pasti nggak mudah. Ini udah sejak tahun 2012 atau 14 ya Bu Yuni ya taburia itu. Tapi kita tetap belum berhasil untuk menjalankan program ini pada tingkat nasional secara keseluruhan misalnya. Di samping tentu saja ada isu dikonsumsi misalkan, betul kan? Selama ini kan data kita selalu bicara cakupan. Lalu bagaimana dengan konsumsinya gitu? Apakah memang itu dikonsumsi atau enggak? Karena contohnya juga dengan tablet tambah darah gitu ya. Kita bicara cakupan tinggi, tapi begitu bicara konsumsi rendah. Nah, hal seperti itu yang mungkin juga harus menjadi perhatian kita semua. Akan baik sebetulnya kalau WFP bisa memberikan rekomendasi sampai ke level itu. Rekomendasi ketiga misalkan yang ingin saya sampaikan tentang mengkaitkan antara beras fortifikasi gitu dengan bantuan sosial. Ini beberapa kali kami sempat ikut diskusi tentang ini. Tapi memang banyak persoalan untuk implementasinya. Misalkan, apakah dari sisi supply, kita sudah siap nggak untuk memenuhi kebutuhan bantuan sosial kalau kita mau memberikan beras fortifikasi dengan bansos? Berapa sih kebutuhan beras untuk memenuhi bantuan sosial saat ini? Lalu berapa kemampuan kita untuk menyediakan beras fortifikasi? Ini tentu saja nggak mudah karena kita tahu bahwa beras fortifikasi sekarang masih dalam produksi dalam lingkup yang sangat kecil. Gitu. Nah, kalau masih, tapi ini sudah di launching ya, sebetulnya akan baik kalau dalam rekomendasi ini diurutkan gitu, mana yang memang menjadi prioritas yang bisa dilaksanakan dalam jangka pendek misalkan gitu, mana yang harus kita tempuh dalam waktu yang cukup lama misalkan. Lalu kemudian siapa yang harus terlibat dalam setiap rekomendasi kebijakan yang disampaikan oleh WFP. Apakah ini di level pusat atau memang di level daerah gitu ya. Sehingga kita tahu sebetulnya siapa yang harus kita sasar dari rekomendasi-rekomendasi. Mungkin itu dari saya. Sekali lagi terima kasih buat Bapak dan Ibu, buat Saskia dan tim. Selamat atas studinya dan terima kasih atas paparannya. Mudah-mudahan kita bisa seperti yang Bapak Pungkas sampaikan ya tadi, ini butuh kerjasama dari banyak pihak untuk memang memenuhi kebutuhan pangan dan gizi di tingkat masyarakat. Terima kasih. Assalamualaikum warahmatullahi wabarakatuh.
Terima kasih banyak Pak Iing Mursalin, Lead Program Manager of National Team for Acceleration of Stunting Prevention or PTP2AK. May I also invite Ibu Felipa Amanta, Head of Research Center for Indonesian Policy Studies, to provide some thoughts. Thank you.
Thank you very much, Bu Rain. First of all, I'd like to congratulate Bu Saskia, Bu Christa, and the World Food Program team for the amazing launch of this very important report. I think this is very insightful and a strong reminder for all of us about the urgent issue of affordability of nutritious food in Indonesia. And I especially appreciate the regional breakdown as it emphasizes the stark difference of food conditions across the various provinces in Indonesia. And it is also very timely as Indonesia is expected to see an increased risk of malnutrition due to COVID-19 pandemic, which also at the same time raises questions and concerns on intergenerational nutritional issues for long-term effects. And I think based on this report, it is time for us to fundamentally rethink our approach to food security to accommodate what the report has rightly so mentioned, the needs of balancing nutrition, sustainability, and farmers' livelihoods, which is a huge challenge to undertake. Some key takeaways for me was the importance of diversification of production and commodities, both from domestic production and trade, and then having a more nutritional sensitive social assistance program and nutritional sensitive value chain as well. So I'm really hoping that the findings from this report will be used to inform policy developments and close the regulatory gaps to improve food system and social safety assistance in the future. The report focuses a lot on government interventions and policies, and rightly so, especially because government plays the key role to shape the direction of our food system. And so I'm really hoping that this report and the discussion surrounding it and the engagements will be taken seriously and moved forward by BAPPENAS, the Ministry of Agriculture, the Ministry of Health, and also the new National Food Agency as well. And in thinking of the food system, however, we should not forget the role that civil society and private enterprise play, such as academia, private companies, farmers' cooperatives, and all of the other stakeholders. I think that is already implicit in the report, but I just like to highlight to make it more explicit so that during that food system transformation, we can make and open a greater space for more stakeholders to contribute to this huge task. For example, some of CHIP's previous studies have shown how companies and private sector can help innovate digital solutions and agricultural technology to help increase productivity of agriculture production in a sustainable manner, for example, or how companies and universities can contribute to research and development to reduce costs of fortified and biofortified foods, which have been discussed previously before of the need to reduce the cost to make sure that there is wider uptake of this potential solution. Or perhaps private food and beverage manufacturing industry will take up more responsibility to reformulate ingredients of processed food in this collaborative efforts to change the food system and the consumption. So hence, in the food system transformation, the policymakers should ensure greater space for stakeholders, a diverse set of stakeholders to participate. And I think only through this kind of greater collaboration that we can together really start to change the food system in Indonesia and reshape our food strategy as well. So once again, this is a huge achievement and a very important achievement. Congratulations once again. And I look forward to continuing the momentum forward and continuing this discussion so that we can actually implement and use some of the findings for policy change in the future. Thank you so much. Back to you, Rain.
Thank you so much, Ibu Felipa Amanta, Head of Research Center for Indonesian Policy Studies, CHIPS. Okay, last but not least, I would like to invite our guest, Ibu Dr. Brian Sri Prahastuti, Senior Advisor, Executive Office of the President, Republic of Indonesia, to also share her thoughts. Ibu Brian? May I invite you to the screen? Hello, Ibu.
Yes, thank you very much. But while I'm listening to the song,
we can hear you clearly, Ibu. It's okay.
Okay.
Yes.
Yeah. I would like to congratulate to WFP who has conducted the study and provided some recommendations that I believe will be beneficial for government and also for other relevant stakeholders. And my apology because I cannot following all the presentation and communication for this session, but I'm trying to understand from the presentation and also from the feedback of the respective responders. And I see that the substance of this study is quite rich and mentioning issue and also solution for stunting and larger scope of malnutrition problem in Indonesia, which is become the concern and priority of our President. And as the representative of the Executive Office of the President of the Republic of Indonesia, this study result might be used as one of the reference when we ask for advisory to the top leader of the country. And but however, the execution will be stronger if made by the technical ministry such as the Ministry of Health, MOSA, and also the Ministry of Agriculture, because some recommendation I see that related to this technical ministry. Last but not least, I'm waiting for the follow-up action and further discussion to operationalize all the recommendations. If can be an answer of debottlenecking strategic issue and accelerating the national priority program. So I think for the next working together, all partners is a must for the best of children in Indonesia. Again, congratulations to WFP. Thank you.
Thank you so much, Dr. Brian. It's nice to see you on screen, Bu. I often see you being interviewed in national television, especially during the early COVID days. Okay, distinguished guests, ladies and gentlemen, we have come to the end of our national launching. Before we go to our closing remarks, please give a round big applause to our discussant and also our presenter. We have now come to the end of our national launching and dissemination of the FNG Analysis Indonesia. For closing remarks, may I please invite Bapak Anang Nugroho, Director of Food and Agriculture, Ministry of National Development Planning, BAPPENAS. Bapak Anang, may I please invite you to be on screen?
Terima kasih Ibu Rain. Selamat sore Bapak Ibu sekalian. Yang saya hormati Bapak Deputi Bidang Kemaritiman dan Sumber Daya Alam, Bapak Deputi Bidang Pembangunan Manusia, Masyarakat dan Kebudayaan, Bapak Deputi Bidang Kependudukan dan Ketenagakerjaan, Ibu Direktur Kesehatan dan Gizi Masyarakat Kementerian Kesehatan, Bapak Direktur Kesehatan dan Gizi Masyarakat BAPPENAS, Ibu Direktur Gizi Masyarakat Kementerian Kesehatan, Ibu Christa, WFP Country Director, Ibu Rina Agustina. Tahun 2022, tahun depan, BAPPENAS melakukan review terhadap RPJMN 2020 dan 2024. WFP dengan hasil ini merupakan satu referensi buat kami di BAPPENAS untuk menjadi rujukan utama bagaimana konsensus, sinergi, dan tindakan bersama dalam mengembangkan pilihan dan prioritas kebijakan dan intervensi yang tepat untuk meningkatkan kualitas konsumsi pangan dan gizi masyarakat. Jadi Ibu Christa, Ibu Saskia, hasil ini tidak disimpan di laci. Ya, hasil ini kami kawal, kami jadikan rujukan, referensi utama untuk bagaimana kita membangun dan mengevaluasi kembali ke depan 3 tahun ke depan sistem-sistem pangan, pertanian, kesehatan, dan juga perlindungan sosial secara terintegrasi dapat lebih berkembang. Tidak kalah pentingnya adalah kita saat ini dalam proses yang masif menuju transformasi sistem pangan yang kita harapkan lebih bergizi, inklusif, berkeadilan, berkelanjutan, dan resilient. Kami sampaikan terima kasih kepada WFP sekali lagi dan Jakarta Post untuk kerjasama yang sangat baik ini. Dan Saskia, terima kasih sudah memberikan informasi yang baik, yang berguna untuk bagaimana kita melanjutkan pembangunan khususnya dalam mengembangkan pangan dan gizi. Terima kasih dan saya tutup dengan Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Terima kasih banyak Pak Anang. Thank you so much Pak Anang for delivering the closing remarks. Distinguished guests, ladies and gentlemen, with the closing remarks delivered, it has been concluded that our national virtual launching and dissemination of Fill the Nutrient Gap analysis in Indonesia has been concluded. All presentation materials are available on the link that will be shown, and you can also scan through the QR code directly. This will also be available on the chat box, so you may directly click the link or you can directly scan the QR code. Thank you very much, everyone, for your continuous support, and we look forward to collaborate with you and have follow-up discussions in the future. A very special thanks to our donor, UN COVID-19 Response and Recovery Multi-Partner Trust Fund and USAID. Thank you very much for our government counterparts and development partners, and also to Jakarta Post for the great collaboration for today's event. I'm Rain Swadamara on behalf of WFP. Thank you for your participation and wish you all the very best. Please stay safe and thank you. Terima kasih banyak. Sampai jumpa. Semoga sehat selalu. Terima kasih.